Hey friends, and welcome to another edition of Timmy Talks. Today might be an uplifting experience. Let's see if it can be. Come along. Okay, so I am making an appointment today at Pace Hospital to see Dr. Lakshmi about a facelift or chin lift consultation. I've had many people request this. Now I just picked her off of the internet. There's no particular reason why I picked her, but she does have very good qualifications. So let's see what it takes to have a consultation and see the doctor. $200 for setup, right, or enrollment, and then $1,000 for consultation. Okay. So the first thing is to get my vitals done in this room right here, and they also have a person to guide me. He's an international. What's your role?
Operations.
Operations. Okay, takes care of international patients. So, okay, let's go. Okay. Okay, just took my weight. Not happy. Okay, my blood pressure is 99/79, and my oxygen sat was... Let's try again. 99. Very good. So what was your name?
Abhinav Kare.
All right. So your job is to really help international patients get around,
Yes.
go to the proper rooms,
Yes.
that kind of thing. That's great. It's a nice
and verify
service.
the passport, visa, and if there is any issue, work
Right.
them out.
You can take care of it. Okay.
Yes.
Very good.
Yes.
Consultation. Dr. Lakshmi, it's very nice to meet you.
Nice to meet you.
So today I've come in to get a consultation for a chin lift. I've had many people in the United States ask me, can you do chin lifts in India? How much does it cost? And so I thought today we would go through a regular consultation and show people what happens when you come in for a consultation.
Okay.
All right.
So whenever a patient comes to me for any consultation regarding the aging changes in the face, first I'll have an assessment of your face.
Okay.
Anyone. Yeah. So and I'll ask your age also. So if it,
How old do I live?
No, I want to know how young do you look?
I will tell you.
Yeah.
How old do you think I am?
Maybe in 35, 40. Maybe. Then you look younger than you are.
I look younger. Hey, that's a good thing. I'll take younger. So I'm a little older, but I have noticed as I get older, I'm getting this little jowls and things like that. So I don't know anything about cosmetic surgery, plastic surgery. I don't know if you really need a facelift or if you can just do jowls, sort of like to lift this area up, but that's your expertise. I don't know.
I can see some sagging skin of your neck. So usually whenever a patient comes to me with the aging changes in the face and neck, first I'll examine the skin quality.
Sure.
And also how much of aging change is there in the face.
Right.
So if I feel so there is like so much of aging, I will definitely recommend them for surgery.
Right.
So, and if not, if it is like mild changes,
Right.
then I will give them option of non-surgical and surgical.
That's great. So you don't jump necessarily right to surgery.
No.
So that's great.
Yeah.
Okay.
So there are multiple options based on the changes of aging on the face and neck.
Okay.
So for you, I can see some sagging, but I don't see that much of neck creases or deepened neck lines and all.
Right.
But I can say it's a moderate change in your aging. And it is up to you to decide. I will give you the options.
Sure.
And you have to decide what is the best one for you.
Sounds good.
We will suggest. So as far as skin quality is concerned, I think you have a good skin quality. I don't see any stretch marks or anything like that. if I see any stretch marks in any like hypertrophied areas, then I think that's a bad skin quality or poor skin quality.
Right.
But I don't see any of that as of now.
Now, I will tell you that my skin, as I've gotten older, does keloid.
Yeah.
So it, grows
Of
extra
course.
scar tissue. And I don't know if that's just comes with age or if that's a condition. I know a lot of Europeans have like keloid skin.
Yeah, so that is a genetic tendency. For some people, they can have hypertrophic scars and keloids. That is a genetic tendency for that particular person to have that.
Does that impact how you get like a chin lift if you were to ever do that?
Yeah. So usually we take extra care in these patients by taking like surgical precautions or measures in which we handle the tissue very minimally.
Little differently, yeah.
Very minimally.
Okay.
And we don't injure the skin so much.
Right.
So these keloids and hypertrophic scars occur in the patients where so much of damage to the skin during handling.
Right.
That leads to prolonged inflammation.
Right.
So we don't want that inflammation to happen for
Right.
a longer time after surgery.
Got it.
So we try to reduce the intraoperative damage to the skin and surrounding tissues.
Sure.
And post-operatively, we give like protocols or skin care regime so that all the scars and all, you will have like softened scar, massages, and if there is any tendency or if there is any sign of hypertrophic scar or keloid, we'll give prophylactically corticosteroid injections into the scar area.
So if someone does come in with keloids, you're active to make sure that the keloids don't form, and then you can go from there. So when you have a procedure, obviously it's done here in the hospital, right?
Yes, of course.
And then how long is the procedure itself? Let's start with that. Like for me, if I said yes, I want it, what would you say?
It would take around 2 hours or so.
2 hours.
2 hours or so.
And then the recovery is done here in the hospital?
Of course, this is a full-fledged hospital, and it is fully equipped with all the ICUs, post-op care, and all, in-house everything.
So if there's a problem, you're in-house.
Of course, we have everything. We
Great.
have everything. We have good support from our anesthesia team, post-op care, and all is perfect here.
Very good.
So you don't need to consider other options
Right.
for post-op and all. So everything will be taken care of from admission to your discharge.
So what do you think, how long is the time for recovery?
So yeah, since it's a face and neck area, usually the recovery will be better compared to other parts of the body.
Really?
Yeah. But I would say it will take around 2 weeks time
2 weeks.
for 50 to 60% of the swelling to go down. Yeah, and 6 weeks time for 90% of the swelling to go down.
Okay, so how, like if a foreigner was coming, how long can they expect to be in the hospital, and then maybe just coming in from the outside for follow-up visits?
So in hospital stay will be around 1 day or so.
Okay.
After the procedure, 1 night stay. Otherwise, if they want to go on the same day itself, we can do a daycare also.
Okay.
That is also fine. But we will give them extra precautions what to
Sure,
look
look
after
for.
and what to look after and those. And otherwise, after the discharge and all, I will ask my patient to stay here in India for at least 2 weeks
2
time,
weeks. Okay.
where the maximum post-op care will be taken care of.
Yeah.
Yeah.
That makes sense. Okay, awesome.
Yeah.
All right, so what are your recommendations if not surgery for me? What would you say?
So there's another option called body tight, where we insert small needle and there's a probe outside. So the heating occurs from inside outside. So the whole layers of the skin are treated with thermal energy.
Right.
They are treated
Thermal
with
energy.
Thermal energy. That is radio frequency.
Really?
So radio frequency energy. So that leads to heat generation.
Wow.
So during this process, when the heat is generated, there is some injury to the tissues. This leads to inflammation and all, and collagen will be produced more.
Right.
So when collagen is more, obviously your skin will get tightened.
Right.
Yeah.
Okay, so it's not the heat necessarily, it's the collagen that's formed after the
Yeah,
heat.
that is what. So we use regulated temperatures during that procedure.
Yeah.
It's not like we can use higher temperatures, it
Right.
will burn,
Right.
of course. So it is all regulated.
Got it.
Yeah.
And it's done through a small cannula?
Small needle side puncture
Yeah.
will be there, that's it.
Wow. And what is the recovery time for that?
It is the same. but usually lesser than the surgical procedure.
Sure.
In 1 week time, I think most of the swelling should go
Really?
off, and the changes you can appreciate in 6 weeks, 3 months, 6
Sure.
months time.
Wow.
Better results.
I also have seen, and I don't know if you guys offer it here, but I saw a video where a small cannula as well, but small hooks are inserted every so often, and it just minimally pulls it.
Yeah. Lift procedure.
Thread lift. Is
Thread
that
lift.
something you guys do here, or is that more cosmetic?
No, I do all
Really?
non-surgical, surgical, everything.
Wow.
Thread lift is a non-surgical procedure. That is a bioabsorbable thread we
Oh.
place inside the skin,
Yeah.
mostly in the subcutaneous tissue.
Right.
And that thread has barbs.
Yeah.
So which hooks the skin and tightens the
Right,
skin.
right.
And this also, the same technique, this also will produce inflammation and collagen.
Right. Okay. So again, it's producing that collagen that's going to
Yeah.
help lift it naturally.
Yeah.
So okay, very good. All right. Well, what? Okay. So the big question: how much approximately? I know it's all going to be different, but how much does it cost for a chin lift or these other procedures that you're talking about? What is the ballpark so people can get a figure?
Maybe between 1 to 2 lakhs in Indian rupees.
Okay, so that's going to be 1,500 to 3,000, depending on the procedure.
Yeah, depending
Okay, and I will say they take credit cards here. So if that's something that you want to do, you can just pay for it with credit card. But a few weeks minimally to make sure that you get your service done properly. That's what's needed. Okay, so my other question: are these bags under my eyes?
Yeah, I can see some like sagging of the skin
Yeah.
and also the eye bags.
Yeah.
So what happens is that there is some fat pad underneath your lower eyelid.
Right.
So that keeps on protruding outside because whatever the septum which has to protect the fat pads inside, that also has stretched
Right.
with aging.
Right.
So because of that, the underlying fat pads are shown.
Right. So what is the recommendation for that?
So usually surgical option is the best option. That is blepharoplasty. Lower eyelid blepharoplasty is the best surgery.
Really? Is a blepharoplasty on the top?
Yeah, we can do blepharoplasty for upper eyelid and lower eyelid.
Really?
Both.
I didn't know that.
Yeah, we can
Okay.
do for both. So for you, I don't see any like excess saggy skin on the upper eyelid, but lower I can see some white bags.
Yeah. The cream takes care of it for now, but soon enough it won't.
Yeah. But I can see some wrinkles around your eyes and
Oh, yeah.
and also the.
That's from being out in the sun. So yes. Yeah, sun precaution for everyone. Sun
Yeah.
precaution. Okay, well, this has been very informative for me. And I think my viewers are going to find it very interesting. I was looking at your credentials online, and you have a lot of good credentials.
Thank you.
So, which is why I specifically made an appointment with you. So,
Thank you.
thank you so much for your time. I really appreciate it today.
Okay.
I really would like to consider doing something, but I'm afraid of scarring. I'm afraid of really something going wrong. And I think a lot of people have that fear about cosmetic surgery because you see so many people and they look horrible. I don't know if you do it here in the United States, but I mean, it's here in India as they do in the United States, but it's sometimes people just look so like fake and, just horrible. So that's a big concern for people.
Yeah, that's actually the patient who prefers that type of things, they will go for it.
Yeah.
So we don't recommend that.
Yeah.
It's ultimately the patient who wants the result that way.
Yeah.
So it is that the patient should be aware of like what they want
Right.
and the outcomes are.
So either a more natural look or that
Yeah.
fake,
Yeah.
really pulled back look.
Yeah.
So, okay, very good. I think it's very interesting that I can look you up at the hospital and make an appointment the same day.
Yeah.
That is not heard of in the United States. I mean, it takes weeks and weeks and weeks, and literally they were like, "Do you want to come now?" And I was like, "No way, give me a few minutes." So it's amazing. It's amazing.
Yeah.
The access that people have to doctors for consultation is unheard of.
Yeah.
It is amazing.
Yeah, this is a surprising fact for many people in other countries, but healthcare is of course accessible to all the Indians, and
Yeah.
and they get to take doctor's appointment the same day immediately, and if they come to emergencies, like doctors will attend immediately.
Yeah.
So they don't need to take that much of like paperwork
Yeah.
and all to take an appointment.
It's amazing. It really is amazing.
So, of course, that's a lucky thing for most of the patients
Yeah.
in India.
Right.
Yeah.
Why I'm saying people should come to India for their medical care, because you can get same day access, you can get next day access, you can get lab reports. You don't need a doctor's note to get your blood drawn. You know, it's amazing the kinds of medical care you can get here in India, which is why I'm showing you medical care.
I'll give you a skincare routine,
Okay.
so that you can follow that up.
Sure.
Yeah. So for the face and neck, like which are exposed areas, even the hands and all, if you are going out for swimming and if you are going into the waters, you try to use waterproof sunscreen. So in the morning, what you can do is that you have to use proper face wash or body wash. So after this, you can use some nice moisturizer and then follow with the sunscreen.
Okay.
So if you are going outdoors, repeat the sunscreen or reapply the sunscreen every 2 hours.
Okay.
So the sunscreen should be at least 40 or 50 SPF.
Wow. Okay.
Because for you, considering your history, this would be ideal.
Okay.
Yeah. And even in the night, you can follow the same face wash, body wash. So you need to use separate moisturizer or body wash or face wash. Like for face, it should be different. For the body, it should be different.
Okay.
You can't combine.
Really? Okay.
And even the moisturizer,
It's different both day and night.
Yeah.
Okay.
and also for your face and body, it should be different.
Okay.
Even the sunscreen. So usually we think that you don't need to apply sunscreen in the night, but that is a myth. So even the LED lights and all, they have some heat energy that will affect our skin. So when you're working in front of the system or laptop, so you can apply sunscreen even during the night.
Wow, okay. And I'm sure it absorbs in your skin,
Yeah.
which helps the next day as well.
That acts like a barrier.
Yeah.
To prevent any sun damage or thermal damage.
Sure,
Yeah.
very good.
The concerns, you can get back to us.
Thank you so much. I really appreciate it. And so how can people get, I mean, they just contact the hospital, make an appointment with you?
Yeah.
Okay, that's the best way to get a hold of you.
It's available on Google.
Okay.
You can just call our number and our communication people will answer and they'll give you an appointment.
Very good. Thank you so much. I really appreciate your time today, and your consultation is fantastic. Thank you. We get walked out to the door. It's nice that we're sort of shown our way around. So
Yes,
you don't have to be afraid of
Yeah.
people not speaking the language or something like that. There's somebody here that can guide you and help you. All right. Well, thank you very much. I appreciate your time today.
Yes.
Thank you. And for everybody coming, this was a nice, easy visit, and it took, I don't know, maybe just a little bit over an hour for the whole thing. So thanks for watching another edition of Timmy Talks. I hope it was informative for you. And now I have some thinking to do for an uplifting experience. Take care now. We'll see you soon. Bye.